Okay, so here we're going to talk about the most common fungal disease of the genital urinary tract, and that's vaginal candidiasis. Now, Candida is a common yeast, and it is a normal flora yeast, and so the genital urinary system is exposed to fungal organisms, and usually it's going to be opportunistic because Candida is kept under control by your immune system. So the most prominent fungal infection of is vaginal candidiasis, and this is caused by Candida albicans. Now, albicans, like other Candida species, are going to be part of the flora. They are going to be found in male and female genitalia, or gastrointestinal tract, but in the genitalia tract of females as well. It's going to be seen mainly as a yeast, so this is a picture of a budding yeast. And the infection can be local or systemic, but usually a systemic infection is associated with immune compromised. So in immune competent people, they can control this infection quite easily. Now, vaginal thrush or candidiasis is going to be a thick white discharge. It's going to be very itchy. It's going to have an endogenous nature. It can be exogenous if it's transmitted through sexual intercourse. Candida, because it's a normal environment yeast and it's a normal flora yeast, it can infect or cause an infection through indwelling catheters and overuse of antibiotics. Antibiotics are going to wipe out your normal flora bacteria. They typically are not going to harm Candida, and so Candida then will be able to grow or have overgrowth. So one of the things about Candida is, as a normal flora fungus, it has just its yeast form. When it becomes invasive, it has a change to a pathogenic form in which it has appearance of pseudohyphae. These are not true hyphae, so you have your yeast and then you have pseudohyphae, and it basically is a bunch of budding yeast that stick together. But they do have characteristics of hyphae in that they are able to digest, so they release digestive enzymes so they can digest your tissue, so they can become more invasive. Now, pseudohyphae, which is shown here, is going to allow invasion. So again, you're going to have attachment to host cells and digestion of host cells. Candida also has the ability to bind to complement 3. And so complement factor 3 is going to be important in opsonation, and this helps your macrophages eat the yeast. So when Candida is able to inactivate complement factor 3, the macrophages lose that opsonization, lose that help to actually take up the yeast and kill it. Now the pathogenesis, again, you're going to have a thick discharge. It has a consistency of cottage cheese. Itching is going to be associated. Some women are going to be chronically infected, so they're going to have repeat bouts of vaginal candidiasis. It can also infect the urinary tract, and it's associated with expanding fungus ball lesions in the renal pelvis. It's going to be susceptible to our azole drugs. So azole drugs are those that target ergosterol, also amphotericin B, nystatins. And the lesions can also resolve spontaneously if there is an elimination of the condition, such as removal of the antibiotics and allowing the bacteria of the normal flora to return.